Good afternoon, everyone. Myself, Dr. Samir Vankawala. I am a retina surgeon from IQI Hospital, Gujarat. I'm going to go through a quick. There are many of cases. I'm going to show OCT reports of my own personal experience with the real world experience with the Faricimab. There is no financial interest in this. This is a case one, and the patient with the left eye has a history of hypertension, diabetes, on medication, and he has taken 6 injections before coming to my hospital, and history of PRP laser done elsewhere, diagnosed as a PDR status post PRP. OCD report suggestive of a cystic fluid and intraretinal fluids in the right eye of the patients. And 1 month after the injections, first dose, the I can see the flattening of the retina and there's sudden resolution of the intraretinal fluids, and I can see the retina asymmetry has started coming up. Again, the same patient has come to me. If I can see the date, he has come to me. The last injection was given on the 30th of December, and the patient has come back to me on the March 22nd. And again, the same problem. Again, the injection was given, and after 1 month, I can see the result, and the intraretinal fluid and the cystic retinal fluid has been start resolving. And again, the same patients. What I can see in after the multiple injection, the second injection was given 3 months after the first, and the third injection was given was almost 5 months after the second dose. So this patient was with the other anti-VEGF before, and after switching to Vabysmo, the duration between the injections has been increased a lot. Second thing which I have find out that the visual recovery has gained beyond anatomical recovery. So right eye of the same patients, you can see the large cystic intraretinal fluids, and after first injections there is a complete resolutions of the fluid. And again, after 3 months the patients come, again he has the same cystic fluids, and after 1 month again there is a complete resolutions of the fluid. And the same patients, the same thing. So what the similar results what I have seen is this, that it's identical to the right eye. The injection was given 3 months after the first, and the third was also almost a 5 months. The patient has recovered very well, and patient is on follow-up. I think she was on follow-up since 6 to 8 months, and there was no more diabetic cystic fluid, and she was maintaining well. There's another case 3, a teacher by a professional and very poor on her follow-up. She is very much studious with her students, and a case of severe NPDR with the CME, and there is multiple hard exudate. If you can see in the OCT finding of the left eye, there are multiple hard exudate at the center of the fovea, and there are intraretinal fluids. There is a mild subretinal elevations. Also, the first 2 injections was given at 1 month interval, and I can see the subretinal intraretinal cyst fluid has been starting resolving, and the hard exudate also starting compromising. Again, the patients after the third dose, if I can see the hard exudates, if you compare the first OCT report and compare the last OCT report, I can see the hard exudate has been removed completely. There are few hard exudates, but patient was maintaining well. This case suggestive of the hard exudates, the hyperreflective areas are reduced on follow-ups. Injection, her vision has been improved. So it has a very good effect on reduction of the hard exudates. The right eye of the same patients, also the same result. I can see on consecutive results, the hard exudate has been reduced after the 2 doses of the intravitreal Vabysmo. So this is a case, another case 5, the left eye, elderly lady with the hypertension, diabetes on the blood thinner. For interest of time, I'm not going through systemic findings. And if you can see on the left side, there are multiple area of the subretinal fluid, intraretinal fluid. There are hard exudates, and after each consecutive injections, there is a reduction of the intraretinal fluid and hard exudates and strengthening drops. The right eye of the same patients are diagnosed as a PDR status post PRP. The similar findings, the patient has a vitreous hemorrhage also, hard exudates also. And after the loading dose of this, the patient has improved well, and vision was improving very well. The case 7 of the 40-year patients diagnosed, she was recently a case come to me, and she has a case of BRVO with moderate NPDR, and I have diagnosed, I sent it to a physician, and then she has recently diagnosed as a diabetic mellitus, lipidemia, and hypertension. This is the first, after 1 month, the pre and post OCT, and the third which I have in my file, she has completely recovered with only the 1 injection. The case 8 of the left eye, patients, this is a case where the patient has a neovascularization. If you can see, and the
I think we will do some up.
yeah. So you so this is one of the interesting case where there is a ERM and the intraretinal fluids, and again there is a subretinal detachment. After 2 doses, we can see there is a very smoothing of the fluids, and the ERM also has been reduced. The traction has also been reduced. So not taking a lot time, and going for a very interesting case, the last one. I think this is a case the patient has the retinal detachment in other eye, and the patient came to me that my other eye vision is also has been reduced. This is the left eye of the patient, and we can see there is a pachychoroid and there is a retina excavation and the intraretinal fluid. The patient has given injection Vabysmo, and after the 2 doses, patient has completely recovered. So what my learning from the injection Vabysmo is, all other anti-VEGF, though have provided the visual gain and durability, the outcomes are not sustained over a period of time. So higher proportion of the patients are going into the non-responding and the recalcitrant stage. So Faricimab is a stronger molecule, allowing the patients to take a fewer injections with a higher disease interval, injection-free intervals. So starting early, it improves the functional and anatomical outcomes. The longer treatment interval will help the patient both financially and also physically. So achieving the vascular stability improves the clinical biomarker of the disease control and stability. So basically, these injections reduce the treatment burden and alleviate the clinical capacity. So thank you. Thank you very much.
Yeah, thank you, Dr. Samir. I think due to lack of time, we move on directly to the next presentation.
Thank you.